The path to parenthood isn't always a straight one. For LGBTQ plus parents, it can be especially complex, and too often, our stories go untold. This is Proud Conception. I'm your host, Rachel Gresson, and together we're giving voice to the many ways our families come to be. We're diving into how we build our whānau, raise our little ones, and shape a world where they feel seen, safe, and proud. Kia ora e te whānau and welcome back to Proud Conception. I'm pleased to see some new listeners and people sharing the podcast in the last couple of weeks. So welcome. Thanks for being here. I hope you're enjoying some of our previous episodes. Keep sharing the episodes and the podcast. I have several episodes lined up for you over the next couple of weeks and months. So keep listening and I hope you enjoy. We've also recently started up on Instagram. I am not a social media guru by any stretch of the imagination. It's a new space for me. So I would appreciate the follow. Come on over to Instagram. You can follow us at Proud Conception Pod. Give me your feedback on how it's going on our socials. And final shout out from me or housekeeping from me this week. If you have a story to tell or you know someone who has a story to tell about how you grew your rainbow family, please get in touch. The reason I started this podcast was to showcase the very diverse ways our LGBTQ plus families come to be. There's no right or wrong path to starting a rainbow family. There are lots of decisions along the way that are not right or wrong. And in fact, the whole journey is filled with deeply personal decisions and a whole lot of complications that you don't necessarily know before you start. But if you were listening to this podcast because you wanted to start a family, you'd benefit from somebody sharing their story. So if the work that we're doing here resonates with you, please get in touch. I'd love to tell your story on the podcast with you, and to help light the way for other people who are thinking about starting their own families. You can get in touch with me on Instagram. You can send me a DM. Again, we're at Proud Conception Pod, or you can send me an email. We are proudconception@gmail.com. When I first started this podcast, one of the things I wanted to do was have expert interviews every several episodes to showcase and highlight some of the people that are working as experts in their field on some of the challenges we face as LGBTQ plus people starting and raising our families. Some of the systems and structures around how you start a family can be really challenging when you're queer. And there are people working on those systems and structures to make them better and more inclusive for LGBTQ plus families. And that's what we're talking about today. I am thrilled to bring you an episode with an expert who has dedicated their life to rainbow care in the perinatal spaces and making sure that those spaces are inclusive and equitable for us. So today on the pod, we're talking to Dr. George Parker. George has a background in midwifery and a PhD in sociology, researching equity and inclusion in perinatal care. They've worked in a range of settings, including community health promotion, government policy, and now they're a senior lecturer in health service delivery at Victoria University in Wellington. They're also queer and a parent of 4 with their partner, Fleur. There was 2 particular research projects that they've worked on that I was keen to discuss on the pod today. The first is the Trans Pregnancy Care Project, which culminated in a report that came out in 2023. It looked at the experience of trans folks navigating perinatal spaces, as well as talking to providers' experiences and some of the skills gaps in providing perinatal care for trans folks. It was a really great conversation with George about this. Some parts of it were a little disheartening, not going to lie. We've got a long way to go in this country for providing inclusive wraparound care for our trans whānau, but the work that George has done with their colleagues is certainly laying the way for that, and we talk in depth about that project. The second project George is working on is coming out next month in September, and there is a chance for everybody listening on this podcast to get involved. So the project is called Inclusion Through a Difference, and it's studying rainbow families. It's studying how we ensure that rainbow families thrive and sort of some of the challenges that rainbow families might face as we raise our kids. The research kicks off with a nationwide survey of rainbow parents. So that survey will be available next month, and I encourage everybody listening to have a look at that and get involved. There is lots going on in the show notes this episode, including there will be information on how to follow George's research so that you don't miss that survey. It would be great if we can all make sure we're counted and our experiences are counted by completing the survey and contributing to research as to how our rainbow families can thrive in Aotearoa. So, without further ado, here's George. So kia ora, George. Thank you for jumping on the line with me. I really appreciate your time this morning, and I can't wait to get stuck into some pretty meaty topics.
Kia ora, Rachel. It's so exciting to be here talking about my favourite meaty topics.
Love it. Before we get into some of your research, both past and what you're working on at the moment, why don't we start with a bit about you? So give us your rainbow roll call, who's in your whānau, and tell us a little bit about them.
Awesome. Well, kia ora. I'm George. I live on the really beautiful Kapiti coast, north of Whanganui-a-Tara. I am a Pākehā, queer and non-binary trans person. My pronouns are they, them. My partner is Fleur, who is also a Pākehā, queer and non-binary person whose pronouns are they, them. So we are like a little perfect pair. Between us, we have a blended extended queer whānau of 4 children, ranging from 20, 16, 11 and 7. So we're covering the whole age spectrum. And we co-parent those amazing kids, including co-parents on each of the 2 pairs. And we do that across multiple households. And we have between us 2 guinea pigs, a 3-legged ginger cat, and at the moment we are co-fostering 2 baby goats called...
That is a busy household. Oh there is a lot going on.
There is so much going on at all times. Yeah.
I love it. And I'm so pleased to talk to you both as an expert and as a rainbow parent, because so far a lot of the parents I've spoken to have quite a bit younger kids. And so when I ask them about how they think about talking about their family, they still have lots of really interesting insights, but talking to a 2, 3, 4-year-old is quite different than talking to, a 7, 11, 16 and say 20-year-old. So I can't wait to get some of your lived experience around how you have those conversations.
Amazing. And it's this constant reminder, and I'm sure we're going to talk about it, of just the kind of incredible diversity of how our rainbow families are formed, how we build them, how we organize ourselves as whānau beyond, in full honouring and respect of the more nuclear family unit. But there's a whole lot of expansive ways in which we make and do family that are kind of beautiful and colourful and queered. So
totally,
we're a great example of that.
I love that. And at the end of the day, we're all doing dishes and we're all doing laundry, but how we divide labour and how we have conversations and how our whānau identify. I'm really keen to get stuck into that. And that's what I kind of started this little podcast for, is to show the different ways that we come to be families, and that we, even if we wanted to try, our queer families can't fit into a heteronormative mold. So why try, and why not just, be who we are in our little whānau bubbles?
Yeah. And within our whānau, we're going to celebrate, there's nothing about how we do our whānau and how we organize ourselves that kind of complies with any of the standard ideas about how people do family. And at some point you're just like, all right, bring it on.
Yeah, absolutely.
We get to live our full creative potential while also doing stack loads of dishes and
Yeah,
washing.
exactly. So how did you and Fleur meet, and how did your family come to be how it is today?
For sure. Yeah, like we both, Fleur had the older two in another relationship, and I had the younger two in another relationship. And yeah, so Fleur and I met each other at like kind of as parents, but also out queer trans people. And yeah, it was a real kind of meeting of minds and worlds, and decided to kind of bring ourselves together in an extended whānau. So it's been a really, yeah, family building, whether that's in a queer sense, whether that is kind of going on that journey of finding a donor and kind of building our families through the kind of fertility, conception, pregnancy, birth process, or whether it's creating ways and abilities to bring to build whānau once we've already birthed our children. It's a big creative process, isn't it?
Yeah. I think
Yeah.
in sort of the pre-email that you sent to me when I'd asked for
Yeah.
some pre-questions, you said we're a year-long pride parade, and I loved that.
Yeah, we're very, I think there's something about meeting your person in your 40s. Like we met in our kind of early 40s. And I met Fleur. I was kind of operating on the assumption that I was one of the very few queer and non-binary trans midwives in the country. And then
You're a part of a
I'm not
special
the only
group.
one. And then I met Fleur, and I was like, oh my God, there's two of us, and we're about to fall madly in love with each other. But yeah, there's something about the kind of more midlife energy that brings a lot of kind of energy for being out and proud. Like you just don't have time anymore not to celebrate who you are and own it. So yeah, we do
I,
we do feel like in our relationship and in our whānau, it's 365 days a year of out and proud.
no, I love that. I love that. I can resonate with that as I'm getting a little bit older. I have
Yeah,
less patience to conform, less patience to
so
not sort of like
much.
just do it because I want to do it, or do it because that's me. Like that is what it is. I'm not 100% there. I do still, I mean, love or hate social media, right? I do still
Yeah,
play the comparison game, which I
sure.
try very hard not to. But as I've gotten older, I've noticed that I'm, yeah, sort of standing in more of who I am more often than I
Yeah.
used to.
And I feel like in my 40s, I'm like, far out. No one told me how awesome that was going to get. Like, I had a really long journey into my gender and sexuality coming out of a quite evangelical Christian upbringing. And yeah, gosh, it feels good. And it does sometimes feel like kind of making up for some lost time of that more kind of uncertain or angst-ridden 20s and 30s. So
Yeah,
yeah.
totally. Oh, I love that. Now, one of the reasons we're chatting today is because of your background and research. You are an expert in perinatal healthcare for our rainbow communities. I know you've dedicated much of your life to this space, if not all of your life to this space. So before we dive into some of that research, can you give us an overview of your credentials and your experience?
For sure, yeah. So my background clinically is as a kahu pokai, a midwife, and so I practiced in community and hospital settings. So my work in the kind of inclusive perinatal care space is really grounded in kind of that kind of knowing and knowledge of what it's like to work in the health system and some of the challenges in the healthcare system. Um, I then kind of drifted more in my career into policy and community advocacy around kind of improving the healthcare system from an equity and access perspective. And that led me into a PhD in sociology, which really went deeper into what it is about the way we're delivering perinatal care that can make it really unsafe and unwelcoming for some people and not others. And now that I am a senior lecturer in health service delivery in the School of Health at Victoria University, my whole entire research program is incredibly dedicated in particular to LGBTQIA plus people's ability to navigate their reproductive lives and potential in ways that they self-determine, including our ability to make the babies that we might want to make and to have a journey through pregnancy and birth that is affirming and welcoming and supportive of us, that sets us off into our parenting journeys in ways that allow us to flourish. And as we'll talk about soon, kind of is starting to ask the question, well, what happens after that? But
I love that you said self-determination in that
yeah,
perinatal space, because I think I really struggled with that, particularly when my wife and I were thinking about how we would even start our family. I think there's so many ways along the way that you get options or choices taken away from you.
yeah.
And I'm coming from quite a privileged perspective or a background when I think about navigating the perinatal space, because we are two white women, cisgender women, and we used donor sperm. So out of the special ingredients that you need to make a baby, if you're using it from your own body, we only were missing one. And so we were still in such a privileged position, and yet that right, or that ability to self-determine and have control over all of the steps and how you grow your family was still something I thought about a lot. So yeah, I love that that's such a central piece of your research and your work.
Yeah, yeah, absolutely. And there just isn't one way, a right way through any of this. And what we know is that a good journey, a good experience, a good outcome for whānau is one where they can shape that journey in ways that are right for them, and have the resources and access to the services that they identify they need, and yeah, and can shape their experience, can have some sense of kind of control and self-determination over it. Yeah.
Yeah. So let's dive into your 2023 research. So this was the need for trans, non-binary, and takatapui to experience inclusive perinatal care. And I think it culminated in the final trans pregnancy care report. For listeners who haven't heard about that report, can you talk us through that work and sort of what the outcome of it was?
For sure. We were incredibly fortunate to receive a Health Research Council of New Zealand grant to do what turned into the Trans Pregnancy Care Project. The leading up to the Trans Pregnancy Care Project, it's kind of, I think there's a lot more conversation around gender diversity and perinatal care now, and that conversation's really exploded in the last few years. But if we kind of go back, even just kind of, certainly if we go back about 5 years, there was very little conversation happening around how the perinatal care system might be experienced by people who weren't women. I think, we see across time a relatively unchallenged or troubled assumption that the people who have babies are women, and therefore that gender-based assumptions woven right through our inverted commas maternity care system was warranted and reasonable, and I think we can't operate on that assumption anymore now that we are seeing a much bigger expansion of technologies and capacities for queer and trans people to imagine having families, and then being able to access the resources to build their families. We're seeing that perinatal care has to reckon with gender diversity. It has to be able to imagine care for people who aren't women. It has to be able to talk about care for people who aren't women. It has to be able to ensure that trans and non-binary people are safe and cared for appropriately inside that service. And so we could see, going back 5 years, that very little thought was happening about that. We had absolutely no information in an Aotearoa sense of who our trans and non-binary whānau were, and we had absolutely no understanding of whether and in what ways our perinatal care workforce were had the skills and knowledge to provide inclusive care to those whānau. So that's how the project came about. And yeah, it kicked off in 2021 with as a two-phase study. So the first phase was to kind of go out and find some of our trans and non-binary whānau who were or had recently navigated the perinatal care system. And the second phase of that study was a national survey of our perinatal workforce around what they knew, understand, the skills, any skills they had, and any barriers they were experiencing for providing trans inclusive care.
I can imagine both of those were quite disheartening conversations, because on the first
Yeah.
phase, I imagine there weren't too many, uplifting, heartwarming stories of wonderful inclusive care. And on the skills-based side with the professionals, I imagine there was some lack of skills there and lack of sort of
Yeah.
comprehension. Was that what you found?
Yeah, you're definitely on the right track. So in phase one, like, we did in-depth qualitative interviews with 20 whānau who had a trans parent in that whānau. 15 of those were the gestational parent. 5 of those were it was the non-gestational parent who was trans, and for some of those whānau, both parents were trans. And of course, when you do these tiny plotted summaries of like big research reports, you are just to be aware that you kind of lose a bit of the nuance or texture. But generally,
Totally.
what whānau told us was that the wider perinatal system was just fraught with cis heteronormative kind of assumptions that made their visibility and their ability to feel kind of safe and affirmed in perinatal care very difficult. And yet there was some really amazing champion, like rainbow champion, largely LMC midwives, lead maternity care midwives, who were creating these beautiful pockets or bubbles of affirming care. And so this kind of idea that if there was kind of affirming care, it was coming down to on the shoulders of these individual, usually rainbow midwives themselves, who were kind of trying to buffer an unsafe system by wrapping as much care and protection around whānau. And we don't have the camera, but if you saw my hands, they're wrapping. So we had these kind of individual midwives doing really extraordinary things, but in a system that was very unsafe, both for rainbow midwives and for our trans whānau. And of course, utterly unsustainable, because when we have individual providers kind of propping up inequitable and non-inclusive systems, we kind of burn them out. Hey, it's no surprise that we kind of exhaust them. And so yeah, it wasn't all bad, but the bad was very entrenched at that kind of system-wide level. And we kind of heard that operating on two levels: the kind of physical infrastructure of systems, so the physical environments, data systems, all of the infrastructure that kind of makes up a perinatal care system just couldn't conceive, wasn't creating space for gender diversity. And then we had really problematic interactions happening within that system, say with the care you got on an antenatal ward or a postnatal ward or in childbirth education, where mostly we're ranged from kind of very overtly transphobic to just, I have no idea, I'm
I've never thought
misgendering
about
you.
you. I have never thought
I've
about
never
you
thought about
as
you. I don't
a
even know
person
what
needing
you are.
care. Yeah.
Exactly.
Yeah.
Yeah. So
Which
that
is
was
super
that.
empowering and makes you really feel like you're coming into
Yeah.
your own as you potentially step into like one of the biggest challenges we face in life, right? Parenthood. So you're about
Exactly.
to step into that whole new journey and identity,
Yeah.
and the person providing you care or the system providing you care can't even see you, can't anticipate you,
Yeah.
has no world in which care is adequately provided to you.
Totally. And whānau told us two kind of consequences of that, and they were enmeshed. One was where whānau really took up this role of advocating for themselves, trying to educate perinatal providers to how to affirm them and why that was important, and kind of all of the like extra mental and emotional labor of that, which was a big stressor, and whānau really talked about how it took away from this kind of much needed focus on the fact that they were having a freaking baby,
Yeah.
and all of the energy they needed for that. And then the other
And the
thing that
joy,
happened,
it
yeah,
leaves less space
so much joy
for
loss. Yeah.
becoming a parent when you're spending a
Yeah.
lot of time doing the mental load of
Like
education.
so much lots of joy. And whānau talked about putting on their armor. Like they use this metaphor of the armor so consistently that they were going into battle. And it just hurts me so much to think that the place of care that should be soft, like should be a nest, perinatal care in my mind, was actually conceived of as some kind of war zone. It's just so counterproductive to the kind of supportive start we need for our queer and trans whānau. The other thing that whānau described was also withdrawing, like disconnecting from care. So either not outing themselves or like deciding which parts of care they could ration to kind of limit their exposure to non-affirming and inclusive environments. And again, of course, from an equity perspective, that's really troubling. So whānau weren't getting the full spectrum of services that a cis and heteronormative family would get, because they were like, well, I have to do that, but maybe I don't have to do childbirth education, or, so yeah, really problematic story. And then our providers, if I was to summarize it, I truly believe this, most providers wanted to do a good job. Like most of our perinatal providers don't get out of bed in the morning wanting to hurt anyone, but they'd had no education either in their pre-registration undergraduate programs or once they were in the workforce to help them to understand who our broader LGBTQIA whānau were, to understand how to affirm us, to help them measure whether they were doing a good job of care provision for our whānau. And so, of course, they can't. Like they didn't know how, and they wanted to, and so there was a big call for education, and there was a big call for leadership. Like actually, the workforce needs to be kind of led from our professional bodies to kind of build their capability. So that's my nutshell. Sorry, and I could go on all day.
No, I love it. Just quickly before, because I do want to talk about your current research, but before we leave that one, I don't want to leave it on a doom and gloom note. So where to from here? Like, what was the recommendations that the project found, and where do you hope, if we have this conversation in 5 years' time, where do you hope things might be going and trending?
That's a beautiful question. And yeah, like I'm very aware that we don't want to do a kind of deficit model and or a deficit kind of discourse about this, because at the end of the day, our community's really awesome at just getting on with it. We have beautiful ways of making and doing family, and our children, what we know from data is that the children of queer and trans families are shown to thrive in the beautiful ways that we do families. So there's that. But also, we were really clear that it wasn't enough to talk about the problem, and that we needed to support the perinatal care sector to build its capabilities. So we ended up developing the Warming the Whare guideline and recommendations for trans-inclusive perinatal care, and we're really proud of that guideline. It is centred on a beautiful Te Ao Māori framework, Te Whare Takatapui, developed by Professor Elizabeth Kerekere, which really beautifully brings together the principles of trans inclusion with the values of Te Ao Māori, and creates this really beautiful guidance for how the perinatal sector, if it implements the values of Te Whare Takatapui, can create these warm, flourishing environments for our whānau. And so that journey continues. We have taken that guideline far and wide. We're running lots of workshops for the perinatal care sector on how to implement that guidance. And we actually are doing a follow-up beautiful project called the Warming the Whare Project, which is a 3-year participatory action research project where we're actually working with 2 perinatal mental health services to really deeply and meaningfully embed that guideline in their practice, and to learn, and we're learning a lot about how we do that in ways that are kind of sustainable and meaningful. So that's maybe that's a conversation for another day. But
Oh, it's such important work. Thank you so much for leading us through that. Just before we move on, there might be some listeners who are trying to start their family now in August of 2025 and maybe can't wait. So, what would be your advice to people who are going through that experience now or about to go through that experience? How do they work within a system that isn't yet there in terms of its capability to care for trans pregnancies? What would your advice be for them to have as much of an inclusive and joyful experience as they can?
Thank you for that beautiful question. And yeah, firstly, sending the biggest warmth and love to all of you whānau who are embarking on that journey. Um, and like, as I said, there are providers who are really passionate about the best, highest quality LGBTQIA plus inclusive care for our whānau, and they're all across the country. So if you're looking for an inclusive midwife, it's really great to take a look at the Find Your Midwife website, and lots of midwives, and certainly it's a recommendation in the Warming the Whare guideline that if you are a midwife providing lead maternity care services, that you are passionate about inclusive care for our rainbow whānau, that you make that really explicit on your Find the Midwife webpage. So the Find Your Midwife, most LMCs around the country can included on that website, and we're seeing lots of beautiful examples of midwives really explicitly stating their care. So that's just a good track. Obviously, also our communities are excellent at looking after ourselves. So ask around, get the heads up on who those awesome and affirming providers are, and use those informal networks. So, and as I said, that if you get an affirming midwife, that midwife will make a huge difference for you and supporting you through a system that still has a lot of work to do. So, that's a really key step. There's also increasingly a number of providers providing explicitly rainbow inclusive childbirth education classes. So definitely hit Google and find those providers. We have some awesome classes running here in Whanganui-a-Tara at the moment called Empwr, but there are providers, again, all over the country. Definitely know of some in Tamaki Makaurau and Ototahi who are starting to really ensure that education is appropriate for our whānau. And we also heard just the surround yourselves with your people. Like, don't be afraid to wrap a big warm blanket of support around you, and take your people with you to appointments, take your people with you into birthing. Don't be afraid to kind of insist on space for our queer whānau, our chosen whānau, or our kind of birth whānau, and wrapping them around ourselves as we navigate that system. And while you're doing that, we are working really hard to change care provision in that system. But yeah, I think it'd be fair to say we're not there yet.
Yeah, no, that's great advice. And like you alluded to earlier, like putting on your armor and having to be such a big advocate for yourself. If that's not you naturally, hopefully someone within your support circle is.
Yeah.
And like you said, bring them to every appointment, make them a big part of the journey, and like task them with that job. Your job is to advocate for me for my best interests, even when I'm feeling a little bit shy or nervous or, uncomfortable about a situation. So
absolutely. Yeah.
So turning to your research today, you're looking at rainbow families. And I think I saw on the information you sent me a new ethics of engagement with takatapui, rainbow parents and their families in whānau. What's that going to look like? What's that all about?
Amazing. Yeah, I'm super excited to talk about this new project. So, and it's kind of like the pigeon pair to the Warming the Whare project. So if Warming the Whare zooms in, like, and really goes into the minutiae of how we change perinatal care to be inclusive. In a way, the Inclusion Through Difference project zooms out, and it says actually the like birthing our babies is, it's not kind of the end of our parenting journey, it's the very beginning of our parenting journey. And I was so struck when I interviewed one of the trans whānau for the trans pregnancy care project. I was in their whare, and they had their baby there, and they were just reflecting on some experiences they were having with their plunket or well childness that didn't feel very nice for them. And then they said, oh my gosh, what's going to happen when our baby starts to go to ECE, early childhood education, and then they were like, and oh my gosh, the doctor's surgery, and then there's going to be school, and it so resonated with me because it's certainly been my experience as a rainbow parent, that the work to try to create space for ourselves and all of the services and organizations we engage with as parents, and to try to have those services and organizations communicate with our children in ways that doesn't make them feel weird or strange about who their
Different.
family is. Exactly. That just never ends. And in fact, I think as our children get bigger, it becomes more work because our children start to ask questions, and our children reflect back to us that they're not feeling affirmed about who their family is. And so this new project kind of says, oh, we've got this work is much bigger than simply addressing perinatal care. If we're going to have flourishing rainbow whānau in this country, we actually need to address cis and heteronormativities right across the kind of spectrum of child-related services. And of course, there's little pockets of that have been happening, but I have the feeling, and that's why I think, just even seeing the response to your podcast, Rachel, it was huge. And I don't think that our rainbow parent-led families have had anywhere enough of the kind of spotlight and attention and kind of reflection that we deserve. I think there's a lot of us, and I think we're kind of in a place where we're battling through the kind of journey to raise our children in ways that are kind of affirming. But I think that the work should be on the organizations and services we interact with, not on our ability to be kind of resilient in the face of those. So I'm not sure if I'm rambling, but
No.
that's where it came about.
Yeah, no, I completely total call that, because I think what I hear you saying is it shouldn't be up to these individual parents and individual whānau to be advocating on an individual level with this particular daycare, with this particular primary school, with this particular soccer club or whatever it is. There should be, I've recently learned the term the Overton window. I'm sure everybody is already across this, but it should be that there's so many of us and we're so expected and we are anticipated that I don't need to advocate for my individual little family to change the forms at this individual daycare to reflect my whānau, because it's already been an accepted norm that this type of family may come into your doors, and we're ready to welcome you with open arms and provide you with the same services that we do in a heteronormative nuclear family.
Exactly. That's become my personal mission, but also it's absolutely the focus of the Inclusion Through Difference project. And unfortunately, that starts with even kind of generating some sense of who our rainbow whānau are. Like, we've been completely left out of national data sets of of what it means to parent and experience childhood in Aotearoa. And I think I kind of mentioned, we've had massive public investment in big national studies like the Growing Up in New Zealand study that really haven't surfaced parents and parent-led families of people who are gender and sexuality diverse. And so it's just this huge oversight. So we went for a Marsden grant for this project, and then that's feeling like a little bit retro now because obviously the government have now removed funding for social science projects like ours. And if you needed a reason why that was a flawed decision, I hope the fact that this project is happening is a reminder to the government of why we would want to invest in social science research. But that aside,
I'll send them this podcast when it goes live.
Thank you. But that aside, yeah, we got the funding, and it's also a 2-phase project. The first phase is a national survey of our rainbow parent-led families, asking parents to tell us who they are, how they've organised their families, and then the second part of that survey is to provide some insight on how our rainbow parent-led families navigate the services and organisations and how and where they experience normativities across those kind of years of parenting up to their children being 18. So it's such a tension with surveys. You want the maximum number of people to do it, but there's tons we wanted to find out. We think we've got the survey down to about 15, maximum 20 minutes to complete, but we're really hoping that it can travel far and wide in terms of getting some of that kind of bigger quantitative insight into who our whānau are and their experiences and services, and kind of a really important snapshot into what's important. Like, what does affirming engagement look like for our whānau? Do we want representation? Like, do we want to see our whānau like ours in posters on the wall, or are there other things that are important to us? So that's what we're going to find out.
Fabulous. And if someone's listening and they are super keen to jump on this and make sure they are counted and part of the survey, and I hope everybody is, how can they follow you and follow this work and make sure they contribute and participate in the research?
Amazing. Thanks, Rachel. So we've set up an Instagram page. It's called Inclusion Through Difference, one word. We've got an amazing community partner, an incredible Pacific Rainbow organisation called whānau. Not sure if you've heard of them, Rachel. They're awesome. And they are going to be hosting our survey on their website. So another thing to do is to follow whānau on the socials. They're on all the key socials. And whānau will have the survey up on their website and will distribute a kind of our flyer when it's live. We're just going through the ethics approval process, so we're hoping the survey will be open by about the middle of September. But yeah, we're going to be kind of getting ourselves everywhere in the meantime to try to raise some awareness. So a big call out to listeners to tell people about the survey, to certainly look out for it yourselves, and to please fill it in when it comes out.
Perfect. I will drop links to all of those in the show notes and also put it on the Proud Conception podcast Instagram as well, so that people can find that. George, I'm going to let you run. I know you have other commitments. Thank you so much for your time today. I really enjoyed our conversation and really love the work that you're doing. Someone's got to do it, and I'm so glad it's you, and I'm so glad you're pushing and advocating for change in these areas that ultimately make a real difference to individual people's daily lives. So thank you so much.
Oh, kia ora, Rachel, and yeah, thank you so much for getting this podcast up and running. It's just so excited when I saw it. And yeah, if whānau are out there and they want to be in touch with us as a research team, also always welcome to flick us an email too.
Thanks for listening to this episode of Proud Conception. If you enjoyed this episode, please consider passing it on to someone you think might connect with it as well. Don't forget to follow the show and leave us a review on Apple Podcasts and Spotify. And come hang out with us on socials. We're just getting started on Instagram. We're at Proud Conception Pod. Until next time, take care. And let's keep building a world where our little ones feel seen, safe, and proud.